In the 1980s and 1990s, people thought dementia was due to Alzheimer's disease or vascular dementia. And we suggested in the early 90s that there was another kind of dementia, which we called dementia with Lewy bodies. And that happened because we had the expertise in the laboratories to see the Lewy bodies in the brains of people dying with this kind of dementia. And we had very good clinical services for older people in Newcastle. So we had good clinical records of what symptoms they'd had and any investigations that had been done. So we could put the two things together and understand that dementia wasn't as simple as Alzheimer's and vascular dementia. We suggested that maybe 20% of older people with dementia had this disease, Lewy body dementia. But that was a rather unpopular view because it challenged the received wisdom, and people didn't particularly welcome it. So they were very polite to us, but they, by and large, either challenged it or ignored it. So we decided to get together the various groups around the world who were also interested in this condition, and we met in Newcastle in 1995. So we called ourselves the International Consortium on Dementia with Lewy Bodies, and I suppose we were a bunch of enthusiasts, but we were able to bring evidence together, enough evidence to persuade people that this was a real phenomenon. The Lewy bodies were really difficult to see in the brain in the early days because we didn't have any particular stains to do it. So in the early 90s, when new kind of staining methods came in, it meant that lots of other groups and other laboratories could also see what we've been talking about. We were able to identify DLB because we had the mixture of excellent neuropathology and neuroscience, which meant we could see the Lewy bodies in the brain, combined with good clinical services for older people with dementia. So we had detailed and accurate clinical records of how the patients had been. And also very important was that patients and families in the northeast of England were willing to give us their time to do a lot of tests and examinations, and then eventually to give consent for brain autopsy. So really it was a very collaborative exercise between the patients, the families, the scientists and the clinical team. The biggest achievement for DLB that's come out of the Newcastle work is, I think, awareness and recognition. When we started, dementia with Lewy bodies was thought maybe to be a rarity, even if it existed at all. We now have a general acceptance that it's a common disorder. It probably affects 200,000 people in the UK and obviously a lot more worldwide. Although it sounds rather dull, probably the most important aspect of this recognition is that DLB is now in the International Classification of Diseases, and similar manuals which healthcare services use to decide whether they will pay to diagnose and treat people, which research funders will look at to decide if they'll support research. Commercial companies will also be aware of. So the official recognition of this disorder is really important. People with dementia with Lewy bodies and their families really want a diagnosis. They want to know what's wrong with them, because that's obviously is the gateway to understanding what might happen next, what treatments might be available. So I think the work that we've done in Newcastle by raising awareness and making DLB an official and recognised disorder has been very helpful to patients for that starting point. Also, one thing that I'm very pleased and proud of is that our work has led to the development of patient and carer organisations, so that somebody who gets a DLB diagnosis can go to the Lewy Body Society in the UK or the Lewy Body Dementia Association in the US and get help, advice and support of a kind which is over and above what the healthcare system will give them. Scientists and clinicians in Newcastle have driven change from the beginning in relation to dementia with Lewy bodies, and they continue to do that. We have initiated some of the first clinical trials of treatments. We've developed methods of brain imaging which help diagnosis, and we continue to have a very active research group who are still adopting that collaborative work between the clinical team and the scientific groups.